to our upcoming certification course on equity in transportation. So I see that a good number of you of our today's audiences were with us for the first intro webinar in February. For the one who just joined us for this webinar, we are planning to have periodic certification course centering equity in transportation. In this first webinar, we just opened the discussion and introduced a number of topics that are going to be discussed in the UFTI upcoming course in summer. Today, as Jasper mentioned, I'm honored to join an amazing mentor whose years of experience centered addressing equity in different aspects of urban, suburban, and rural life, Miguel Vasquez and Susan Wood. Before sharing the agenda for today's discussion, I would like to see whether you have had any experience working on or leading a public engagement phase for a transportation project. And we will have actually two questions. In the first question, we would like to know in which sector you're working. And in the second one, we would like to see how is your relationship with community engagement phase of transportation project. Jasper will share the poll with you. So we will have time till the poll is closed. Jasper, please. So with 80% response, it seems that we have more people from state, regional, and local government. It's very similar to the previous webinar that we had. And the majority of you had experience working in community engagement phase of transportation project in some areas. Some of you was involved as a team member, and some of you actually designed the community outreach phase. Okay, so let me take a look at the results of the poll. 58% of you work in state, regional, local government. I see a similarity between the previous poll and this one. And we have fewer people from nonprofit and grassroots organization and fewer people from federal government. And the majority of you, 43%, was involved as a team member in community engagement phase, and a good number of you were also leading and designing a community outreach phase. That's amazing. And we have 36% who were not directly working on community outreach. It's actually a very good and diverse set of professionals who work in transportation. Thank you for participating in this poll. It gives us an idea of how we want to run this webinar, and also how we are going to work on upcoming certification course to attract more people from nonprofit, actually, also, and also academic sector to this series of webinars. So what we have for today is we had welcome and introduction, and after that we're going to talk a little bit about the February webinar. So we have refresher summary of the February webinar, and then we will talk about and we will introduce an open discussion on strategies to improve public engagement. After that, we will introduce a few tools and techniques for public outreach that you can use for your own project, and we will expand on it in the upcoming courses. And then after that, we introduce 3 notable practices of transportation project across the country that they use different techniques to improve their community engagement and uplift equity throughout the transportation planning and implementation process. And after those notable practices, we will have Susan Wood. She will share her experience with the community outreach phase of Reimagine Rtd. And then After the Susan session, we will have an interactive exercise together. We will provide you with a proposed scenario and ask you to kind of let us know when you're going to start community engagement and how and why. And then we will have, after seeing the results of our exercise, we will have Miral talking and introducing actually the second principle of the field initiative, field nationwide initiative we shaped during the pandemic. The second principle focused on community-based advocacy, and we will talk about the reality that we should acknowledge that the community is in charge. And at the end, we have discussion, and we will talk about upcoming certification course. So in previous webinar, we talked about equity as an ill-defined term in transportation field. We mentioned that it seems very complicated to run an equity analysis in transportation projects sometime, and there are many reasons for that. First of all, there are many types of equity that we should educate ourselves about. And then second, there are a diverse set of potential impacts that can change communities' life that we should be aware of very early in the process. And third, if you take a look at existing knowledge around equity in transportation, there are numerous ways to measure impact, and not all can lead us into the correct direction. And at the end, we all are used to categorizing everything, and there are uncountable ways to categorize different groups of people who are impacted by transportation-related projects. And we can choose one of those types of categories for when we are working with for our project with the specific communities. The table that I'm sharing here, it was shared in previous webinar. It provides you actually with examples of different aspects of equity, examples of different ways of categorizing people, examples of various methods that you can use to measure your commitment to equity throughout the process, an example of potential impacts of transportation projects. It's developed with Todd Littman from Victoria Transport Policy Institute. I highly recommend their report, which is called Evaluating Transportation Equity. It has so much things to learn, and I think that will be very useful for all of us. And then just to put it a bit of background on that, for example, when we are talking about categorizing people, you may use different ways of categorizing people based on different issues that your projects are addressing. But we always should be mindful of whether the tool and method that we are using or the categorizing system that we are using give us a truthful image of the impacted community. And it actually hints to the value of multidisciplinary collaboration. Every one of us bring a different perspective to the project. And then what you see in this slide actually is lessons learned from an equity analysis performed by MPC in Chicago, Illinois, of 40 largest MPOs across the country. And it's also partially reflect on lessons that we learned during our previous webinar. So in previous webinar, from reviewing existing guiding principles and comparing with the state of practice, we found that equity criteria weighs must be higher than it is right now in transportation project. And then equity is an issue that should be addressed and need to be addressed in all type of transportation project. It's not something that you should consider to be mindful about just for like complete street project or toll pricing. It's something that you should, it's an issue that you should consider to truly analyze and address throughout all type of transportation project. And the third lesson that we learned actually was that at a very early stage in the project, you should truly analyze potential benefits to historically underrepresented and underserved communities and prioritize those benefits. And then also at the very earliest stage of the process, you should evaluate burden to prevent negative impact in all the stages of the project, from planning to design to construction stage of any transportation project. And the essential thing is that we cannot and should not make assumption that disadvantaged transportation users are a homogeneous group. There are different groups of people with distinct travel behavior, with different cultures and different ways of communications that it is essential to be considered for community engagement specifically. And then at the end, we should measure the success of our projects by considering whether different projects address concern and needs mentioned by community members throughout the engagement phase of the transportation project. So here is our main focus for today. What is public engagement and how we can make the process equitable? It's generally, the public engagement generally is defined as the process of two-way communication between citizen and government. And actually, we go beyond such general definition that you see in high-level reports. For us, public engagement is a collaborative effort between citizens, nonprofit, private sector, and government. And this collaboration should start very early in the process, as I've said before, to allow the project sponsor, transportation agency, and other sectors involved to be aware of the problems and impacts as seen through communities' lens. So what you see is that most agencies have adopted the public meeting as the primary means to gain input from the public, as it meets the requirements set forth by NEPA. So there is an issue here. As long as transportation agencies are complying with minimum public notification requirements, it is not surprising at all to see results such as insignificant public turnout, little or no meaningful discussion with the public, and even confusion of what the public process is trying to accomplish. So if we define equitable process, there are four main outcomes of inclusive public engagement process. For valuable outcome that we all want to see throughout our projects and throughout the projects that we are involved in our professional life. First of all, public ownership of policies and sustainable and supportable decisions. Second, decisions that reflect communities' values. And third, efficient implementation of transportation decisions. And at the end, enhance agency credibility among communities. In other words, trust between community and government. So presently, in the situation that we are right now, this collaborative effort of involvement of public input into assessment of transportation needs and solution is the key factor in every decision-making process, as is defined. And that's the reason why every one of us should know how and when to do this. So the question is when this collaboration should start and how. It's actually the central question of today. And also summer certification course that we are going to dig deeper through several exercises. So to start actually conversation on strategies to improve public involvement, we need to start with a bit of background of different phases of a potential project. Because it's different in different phases, you can invite communities to the table in different ways and also for different questions that need to be answered. So if you divide transportation project into three main phases, those are first planning, second design, and third construction. So we're going to discuss a bit about each phase and then how to collaborate with the impacted communities and in a broader perspective as stakeholders. So planning phase. So during planning phase, as we all know, we are figuring out the issues that we are going to address. For example, if there is a need to add bus stops and change bus scheduling based on previous planning and research, we need to know which locations work best based on communities' needs. Second, which bus stops need to be improved, considering like design and safety aspects. And then third, what are the main reliability issues that communities face? So we are focusing actually mainly on how we can help make neighborhoods safer and more accessible through public transit. And we'll start for sure with reviewing existing plan, environmental regulations, and previous community input, engineering constraint, budget, to understand what is both preferable and feasible. And community engagement in different ways helps us understand where to start and which issues need to be fixed first. So help us to understand and prioritize what we need to do. So here are some of the questions that we seek answer for in the planning phase. Whether we can meet an improvement based on available funding or we need to apply to other sources to cover expenses. The second question, what are the priorities when it comes to public transit from communities' perspective? The third question, what is presently working well and what is missing or malfunctioning from communities' perspective? So there are community traces in these questions. and there are many more questions that we are going to ask for this specific example that I mentioned. And we need to start early to understand those issues through the community's lens. And here are like some of the methods that we can use. For example, we can have a stakeholder meetings in different places, in their neighborhood, and in schools, in churches, those type of diverse places that community feel comfortable to talk to us. And we can have a small group meeting, or we can have focus group session with the community. We can do hold community presentations, and also we can conduct surveys with the community, short surveys that helps us to understand specific issues that we are seeking answer for. And also at the end, we can have open houses for the project. So it was one of the phases, planning phase. Now we are, imagine that we are in design phase. So during this stage, we actually we are moving to a more tangible and concrete solution from the concept. For example, from planning phase, we learned that there are 5 main stops that are dangerous by design and need improvement. And second, 6 locations require further evaluation for being considered as bus stop. And third, we need to consider other funding sources as available funding is not sufficient to meet the need of the project, or we need to define 2 separate projects addressing different issues communities face regarding number of bus stops, safety, and reliability of services in the area we are working on. So we actually split project into early design when 10 to 30% of the design is completed, and late design when 60 to 90% of the design is completed. In different stages, we have different type of input. For example, in early stages that 10% of the design is being completed, we collaborate with the community stakeholders and engineers to draft potential design ideas together and make proposal for community input. And then in late design stage, and when 60 to 90% of the design is completed, we generally can make small changes and ask for input to finalize details like type of bus stop or bus shelters. And there are different ways as to collaborating with community in early and late design phase actually of the transportation project. They can vote on project alternatives, for example, and discuss different concepts. And then they can engage through social media. We can create a project phone line and they can call in. They can attend open houses, and we can have a project inbox, and they can email us and provide us with their written comments. And then at the end, we have the construction phase. It is when actually the project is happening, and we need community input throughout this phase to minimize impact on communities' health, access, and economic status. It's essential actually to inform community throughout the construction phase and inviting them to collaborate with us in mitigating potential impact and updating them about the upcoming changes in access, which is very essential to do that throughout the construction process. So those are like 3 main phases of a transportation project that we need to reach the community and start conversation very early on to solve the issues in a way that it will be acceptable for the community at the end. So the second way to, the first way to improve public engagement equity was acknowledging that there are 3 main phases, and in all those 3 main phases, community input is essential and is necessary. And inviting the community to the table is necessary as something that we should truly consider through planning phase, design phase, both early and late, and also construction phase. And the second way to improve public engagement is actually addressing equity. Equity informs all aspects of our work, and there are so many agencies across the nation that they have like a toolkit or guidance to check our work based on like racial equity and social equity measurements. Look at yours. I'm not sure if all of your organization has such a thing, a racial and social equity toolkit, but look at yours. If you have one, you see that there is one in place, but it may need updates. There's so many of those toolkits all over the country for different organizations that has been produced many years ago, and they haven't done any update on that. and it needs update as the population is a dynamic entity and is changing. We need to add chapters and rewrite some sections and provide our employees with more detail about issues that need to be addressed in everyday practices. So here are some of the ways to address equity throughout the project specifically. First, go through and apply your agency racial equity toolkit throughout the process. Second, prepare a public involvement plan for every single project, considering every project unique set of racial and social issues that need to be addressed. I remember from my experience in consultants that we just developed PIP for the projects that had high sensitivity. For example, there was a very high income area that we were working, and they didn't want to have more volume of cars going through their neighborhoods. And it was the first time that I developed actually a public involvement plan. But there were so many projects before this project that we were working actually with the areas that mainly minority population live, but we never think about that, like developing PIP for data specific project because the area was small, for example. But it's important to develop a PIP, public involvement plan for every single project, considering that there are unique things, unique issues that each project have, and we need to carefully address those, not just to the for example, community impact assessment is a very good document, but it's not enough, And then third, dig deeper into DOT LEP guidance and see through LEP population lens, even though they consist of less than 5% of the community in project areas where they're mostly being impacted. And then at the end, collaborate with the community members and minority-owned businesses to minimize impact of every of our project on their daily lives, and work closely with like organization and groups who support vulnerable transportation users, such as like older adults, kids, or individuals with disability, or pregnant women, or other groups that are considered as vulnerable transportation users. And then the second strategy that we have to improve public engagement actually is understanding that early and ongoing input is important. So according to transportation efficient communities, cities and counties that seek early and ongoing input from the affected communities are more effective at delivering projects and services to the people they serve. So early and ongoing continuous input from the community ensures accountability first, and then effective communication and consistency throughout the process. So transportation efficient communities report on how can cities and counties meaningfully engage communities, actually frame performance measures very well. So here are some of the performance measures they shared to analyze your community engagement effort. First, you can see that better activities, formats, and technologies that you're using are working. And second, are engagement activities helping us meeting our goal? So it's critical. It actually hints to a critical point. Setting a goal for a community engagement phase. It's very important to know what we want to get from that community engagement phase. And then third, what would it look like if there was no engagement at all versus what it looked like when you did it? What is the difference, what we get from it? And fourth, how much are or aren't we meeting our goals qualitatively and quantitatively? So to analyze your community engagement effort throughout the process and to see if it is working, it was to do some and to have some actions. For example, first of all, you can conduct a short survey to the community you work with throughout the process. And then second, present the stakeholder feedback in discussion and presentation to the community and ask for the input about that. And then the third one is providing an opportunity, anything like a call center, like a mailbox for community members to frequently provide verbal or written feedback throughout the implementation phase and also afterward. And then At the end, analyze complaints, communities' complaints before implementing community engagement versus post-implementation of community engagement to see how things change and what issues are persistent throughout the process. So now that we know a little bit about how to improve community engagement, it is the time to talk about tools and techniques. Again, we are going to extensively discuss how to improve community engagement in our upcoming courses, and it was just a brief review of that. So during the first webinar, we introduced a set of indices and tools that can be used to measure our commitment to equity, such as racial equity impact assessment. We talked about it later. Here, we are trying to study different angles of our community's life. And these are 3 examples of online sources that can be used to understand your community from different angles and different scales and considering diverse set of indicators. So I started introducing the first one, which is the EJ screen, and you may know about it and worked with it before. So the first two, EJ screen, which has been being widely used, is a combination of environmental and demographic indicators. It has actually 11 environmental indicators, including traffic proximity and volume and particulate matter, and also 6 demographic indicators, including percentage of low income, people of color, less than high school education, linguistic isolation, individuals under age 5 and individual over age 64. So the good thing about this tool is that you can use EJ screen at neighborhood level. You can also add shapefile and do your own analysis with this online tool. The second tool that I want to introduce and talk a little bit about is the CDC Social Vulnerability Index. So it actually talks about potential negative effects on communities caused by external stresses on human health, including like human caused or natural disasters. And reducing social vulnerability can decrease both health and social inequities and economic loss. So CDC Social Vulnerability Index actually uses 15 US Census variables to help local officials identify communities that may need support before, during, or after disaster. It is mostly focused on disaster and disaster management. However, it is very useful. It provides very useful information that can help us understand who is suffering from the present situation and should be considered as a priority to be reached too. And this index actually is updated every 2 years based on US Census Bureau data release. It has also a census tract level data. And the third sources that you can use is National Equity Atlas. It's another free online tool that helps you to choose your indicator and see where your communities are in regard to that indicator. As you can see, there are indicators are, for example, race and ethnicity, population growth, median age, racial generation gap, diversity index, and you can choose those and see and explore where your community are in regard to those indicators. This tool has 4 geographical scales. It provides you with information nationwide at the state level, regional level, and also city level. But it doesn't have information for all cities. Therefore, it has limited usage compared to other tools. And it doesn't provide you with the neighborhood level information, but it gives you an idea when a very good idea when your project has a regional scale. And the other thing about that is that National Equity Atlas indicators track changes over time and are comparable across geographics and are aggregated by race and other demographics as much as possible. So these are just a few of existing tools and techniques that I found very helpful to introduce for today's webinar. Also, all of these tools are very helpful, but most of the time we decide to run our own analysis using GIS. And among all of these tools, the ones that we can always use is EJ screen that gives you an opportunity to run your analysis and add your shapefiles, as we mentioned before. But besides these free tools, online tools, there are many paid opportunities that you and your organization and agency can evaluate to potentially use for your upcoming project. To name a few out of many I can say like city engine and urban footprint are two of the available paid opportunity. With those, you can run lots of analysis and understand different aspects of your community's life, from social to economic evaluation. And then now we know some tools to understand our population. Here are some tools to maximize their engagement. In this slide, you see two web pages that both have tool inventory for transportation project. Many of those tools are open sources, software and free. To name two of those tools, I can name Street Sketch, which was developed by Mobicon and helped communities to design their favorite street. And it's really very helpful when you're asking your community to help you design a complete street, for example, for a complete street project. And it's really easy to be used by any community member with access to internet, or being used during a community meeting with the help of a project team member. So Street Sketch actually is based on another tool that was developed with a Street Mix, and Mobicon actually gave it a kind of European flavor. And it makes it very easy to rapidly prototype innovative Dutch-inspired ideas that involve, like, for example, bicycle streets and shared spaces, those type of concepts. And the other tool that I put an image of it on it in the bottom of the slide is Street Plan, which is a free drag and drop tool. It helps you to create your concept in a few minutes to use in your meeting with your city council, planning staff, developers, and citizens in the community meetings. It also helps you to evaluate your concept based on best practice guidance from ITE and CNU. So speaking of community engagement guideline, there are a number of good examples across the country at the state level, beside numerous examples from nonprofit sectors that we talked about in our previous webinar, and we will expand on it in our upcoming course. Here is an example of a best guidance on maximizing public engagement, Hawaii DOT Guide for Public Involvement. In this plan, they have two sections specifically dedicated to culturally sensitive outreach and EJ, and also how to develop a PIP. And at the end, they provided a project delivery checklist, including Hawaii DOT guiding principle for community engagement. And among those guiding principles, you can see build public trust, early and continuous information and input, and diverse public involvement strategies and methods. So the guide discusses the value of Hawaii culture, different level and types of engagement for different purposes, and how to make engagement successful. I highly recommend you to take a look at this example and see how you can use some of their tips in your upcoming project. So the Hawaii DOT guidance is also asking engineers and planners to talk about their objectives of the project public involvement program. It's very important, and you can see that everywhere. What you want to get out of public involvement process, it's very important. Do you want to raise awareness? Do you want to build trust, or other goals? Which is essential to know, as it's kind of define your way, and it helps you to better design engagement process. So just a bit of background on trust. We trust issue that we face in everyday practice, and we talk about it a lot. And we just, talk about it in every single community engagement related program, webinar, or event. I think it's the time to kind of dig deeper to see why it is critical, and we talked about it in previous webinar. So to put it simple, I just want to talk a little bit about trust. To put it simple, our relationship with the community is quite similar to our relationship with each other. What we do as government or academic sector, like any project that we are working on, and the impact on that on the community, sometimes can be seen as betrayal from community's perspective. So psychologically, a betrayal is breaking of an agreement, implicit or explicit, that is considered vital to the integrity of the relationship. And our agreement as public service servant is to honestly serve the community. It doesn't matter where they live, their zip code, or what are their ability mentally, physically, economically, and etc. We are here to serve. And when community feels in other way, it's when we face a broken trust situation. And here are some kind of tips in a situation of a broken trust. First of all, as a planner or engineer or policymakers, we should first acknowledge our action. And before actually the community complain about an issue, like talking about an issue we already know it exists, and ask them for the input and create an environment for candid conversation on what they need to be done to address that issue. And second, address the question and concern that community has in an honest and candid way. We as employee should have permission from our employer to talk freely about existing issues that communities face. It's actually a central piece of any successful community engagement effort. And I will provide you with an example among the notable practices from California that it was the central piece of their success. I mean, it was something that resulted in the success of their community engagement effort. It was very successful because people felt that people from the government were honest with them during the workshops, during the community engagement process, and they talked with them very friendly and without any, barrier, any type of barrier. So third is listening to them, listening to the community, and make it a continuous practice. Listening without disputing is not equivalent to agreeing with someone's point of view. It's important to know that. And where we meet people is important. And it's important because people will talk their truth to you and will talk very, very comfortably with you if they are in a friendly environment. And friendly environment is actually a key to give them an opportunity for a candid conversation. And fourth, take responsibility of your agency's action and its consequences for the community, and partner with community to find a solution together. Don't blame others for a situation that your agency caused or your agency played a role to cause that situation. Take responsibility and start working with community to solve that issue together. And the second guidance actually that I want to briefly introduce is a smart transportation guidebook from Pennsylvania and New Jersey DOT, which is a bit dated, but it's still one of the most applicable documents that worth to read, and I recommend you to take a look at that. You can see the link to both of these documents here in this slide. So there are not many available tools to actually evaluate the process and measure our commitment to equity throughout the process. We're actually working on one based on the Phil principles, and I assume it will be available sometime next year. But racial equity impact assessment, as we introduced briefly in previous webinar, is one of the available tools. It's actually a systematic examination of how different racial and ethnic groups will likely be impacted by a proposed plan or decision. This assessment tool is actually being used to minimize unanticipated adverse consequences in different contexts. For example, it has been used for the analysis of proposed policies, institutional practices, or plans and budgetary decisions, and even assessing workforce development programs and operations. In regard to transportation project specifically, the racial equity impact assessment tool helps us to assess economic policies and public spending, which have considerable impact, positive or negative, on different racial and ethnic groups. So it can be used throughout the process as one of the tools that can help us to understand our commitment to equity and evaluate the process itself. And the other tool, as you can see in the graph on the right of this slide, is, and I would like to introduce that, is the Robert Wood Johnson and Gale 2018 Inclusive Healthy Places Guide. And they actually provided a matrix called Inclusive Healthy Places Framework matrix. They provide a set of drivers and indicators for each phenomena. We just focus on the second part of their index, which focus on civic trust, participation, social capital. They have 4 different areas: context, process, design, and program, and sustain. So this guide is not directly related to transportation. It actually focuses on public spaces. And because the streets are public spaces, and many of us during the year work on several projects impacting or designing urban plazas and creating or minimizing people access to public spaces, I think and I believe it's essential for us to know how to measure success of a public space. This guide and its indicators actually helps you to understand, for example, what is equitable investment in participatory process and how we can evaluate the impact afterward. Here I just share indicators related to their second principle, which discuss participation, civic trust, and social capital. And this slide presents a table introducing indicators and metrics for civic trust and participation. This section for participation in this slide is not complete, and there are other indicators for this section that I'm not going to discuss about that for today. So investing in participatory process is the central focus of our discussion. And Gail framework introduced 5 metrics to measure our success. So we should check our agencies and organizations to see where we are in regard to each of these 5 metrics. For example, where we are in regard to the presence of public process that accommodate, support, or require partnership. Do we have such relationship established, or we need to initiate it and start from there? Or second, does your organization or agency have participatory budgeting as an essential phase of transportation project? If not, how can you initiate it? What are the steps needs to be taken? And third, are there funding available for community-generated projects? And if not, are there technical assistance program in place to help the community seek their funding and improve their neighborhoods? So those are a few metrics that they provided in the report, and I highly recommend you to take a look at this. Now, we would like actually to see where each of us are considering our agency and organization approach to community outreach. So we have let me just share the questions. So the question is that, which of the following metrics are applicable to your agency and organization? And Jasper, could you please share the poll with the participants? So allocation of funding available for public engagement per capita, allocation of funding available for community-generated project per capita, presence of technical assistance for community-generated project, presence of participatory budgeting, and presence of public process that accommodates, support, multi-party partnership, multi-agency, private, public, and private-private. So with 35% of our, actually it's rising, so I just wait to see the whole. So 53% of our participants answered to this question, and we see that, yeah, so 51 votes. And as you can see, the vast majority of you have public processes in place that accommodate and support multi-party partnerships. But the part related to available funding for community-generated project per capita is the least mentioned one. And it's actually something that you can find if you just take a look at the new community engagement guide and how they emphasize on community-generated project. And it seems that there is a huge gap in this regard. But we were more successful to provide technical assistance. For example, every city and so many of the regional entities, they provide technical assistance to the communities in different ways. And I'm not talking about success, whether the program is successful or not, but it's something that is available, but we need to work more on available funding for community-generated project. So thank you very much, Jasper, and thank you very much everyone who participated in this poll. Now, we provided a bit of background and tools and techniques and ways to improve engagement. It's time to introduce a few successful stories. We chose these stories in case studies based on geographical locations, project scales, and techniques and outcomes. The first case study actually is Washington State Ferries Division Mukilteo multimodal project. The WSF proposed to relocate the terminal to the former Air Force tank farm property to reduce congestion, improve operation, improve multimodal connection, and accommodate future growth. But the thing about this location was that the location of the project was very significant to tribes, and for centuries, the Mukilteo vicinity was a tribal gathering. And the project site was actually the location of signing the Point Elliott Treaty in 1855. So in January 2010, WSF and FTA reinitiated consultation with all 11 tribes whose ancestors signed the treaty. And WSF and FTA have worked closely with the consulting tribes to avoid and minimize and mitigate effect on cultural resources, habitat, and treaty fishing activities, which was essential for the tribe. And the project team had a principle of early and ongoing consultation with the tribe. So they consulted with tribe at key project milestones throughout the project development. And they presented project documents to the tribe for the review and comments throughout the process. And the key milestones that was included to work and collaborate with the tribe on that were project scoping, proposal needs, range of alternative, discipline report for cultural and environmental resources, drafting environmental impact statement, project design element 2, final environmental impact statement, and joint aquatic resources permit application. So there are so many different milestones, and I didn't want to mention all of those. So in all of this project milestone, WSF collaborated with tribal community, and overall the project team had 36 different type of meeting the community in variety of ways, including individual meeting with Secretary of Transportation and Director of Ferries and tribal church and councils and working groups, individual meeting with technical staff from each consulting tribe, and all meetings were held in tribal offices, and intertribal meeting with tribal leadership and technical staff. So there were so many different ways that they had meetings with, and they collaborated with the tribal groups. And it was important actually to tribes, it's another important thing, it was important to tribes and WSF and FTA that the terminal design reflect the historical and ongoing cultural significance of the site. So the project team invited each consulting tribe to participate on a design committee. And WSF worked very closely with tribes and other agencies to identify ways to minimize overwater coverage of the final design and effect to the habitat and treaty fishing activity. So the key to success is ongoing relationship with the communities that you are working. And WSF for this project did not finish and stop consultation with tribe when they received environmental permit for the project. They collaborated with 4 tribes that have treaty fishing rights in the project area to develop operation protocols. And the purpose of that protocol is to coordinate with tribal fishers on WSF vessel and construction activity. And then also WSF and tribal cultural resources monitors were present on site during the whole construction period. And the photo that you see here, the one on the top is the final project completed, and the photo in the bottom of the slide is actually the ceremony, which is called tribal blessing at the opening day of this project. So the second case study is a case study from California, the Gilroy community-based transportation program, which was actually a transportation study funded by Metropolitan Transportation Commission to identify transportation needs of low-income communities in the city of Gilroy and many communities in unincorporated areas of southern Santa Clara County. So the project included an extensive public involvement plan, during which the Santa Clara Valley Transportation Authority used new public outreach strategies to discuss and explore transportation issues with the target low-income communities. And the project actually intended to identify transportation solution to address the need that they found during the PIP, and then to further evaluate those solutions to determine like a realistic implementation schedule and explore existing and new funding sources, and also the agencies or agency who can be responsible for the implementation of the final solutions. And so during the 6 months PIP, specific neighborhoods were identified, and agency partner were contacted, and a nonprofit who is very prominent in the area, known as the South County Collaborative, helped VTA target communities in Morgan Hill, Gilroy, and many other communities in the southern Santa Clara County. And a diverse set of tools actually were used to notify and communicate to diverse groups of community members. And documents were all translated into Spanish and Vietnamese. And tools that were used to seek out community involvement and feedback actually included a variety of tools, like they had a community advisory team meeting, they had working groups and task force, a small group reading, formal presentation to the community, and also workshops. And workshops actually were considered as the most successful part of their community outreach, and they attracted a very diverse group of people, from young people to seniors. And so when we're talking about the success, measuring the success of community outreach and public involvement program, actually, there are quantitative and qualitative way to measure the success of that. And for this specific project here, I just provide you with some examples and some traces of success for this project. So for any public involvement effort, it's essential that communities participating in PIP process reflect demographic diversity within impacted communities. For this project, actually, Hispanic population made up 80% of the participants, that exactly mirrored the demographic of Gilroy and the areas around it. And the most of the participants claimed that they lived in low-income households. So they were successful to attract the community and have a representative group of people being in the workshop and other community engagement efforts and activities. And VTA staff actually had the goal of 1,000 survey being completed, but they received more than that, 1,086. It's something that is very important for so many of us that we are working with the community. It's a trace of kind of interest from the community to the project that we are working right now. Like, for example, we face challenge for one of our projects to get input from a part of the city that we are working on. And when I saw the result of their work, and I was like, it's really a quantitative way to say that we were successful. And then workshops for this project, workshop had a very friendly and friendly and democratic environment, and everyone was able to share their thoughts freely. It's one of the, I actually mentioned it in one of the previous slides, that it's important that the staff member also spoke candidly to participants, and it's something that happened. So VTA staff members also spoke candidly to participants about the specific issues that VTA didn't address or hadn't gathered in the past public involvement processes, and ask for the community to help with the the understanding the issues and find a solution for that. So it was very important to kind of confess that we missed that, and we want you to help us to address something that we have been missing in the past few years. And then following the public outreach period, they shaped a project working committee. And they started having session and creating a list of proposed action to address the transportation issues identified during the PIP project, PIP process. And the committee actually evaluated transportation proposal and make recommendation to kind of cure existing issue based on the recommendation that they found throughout the PIP process. So our second case study presents a citywide equity effort. As we discussed, actually, equity issues are changing, and every day we face new issues that need to be addressed. And that is the reason that racial and social equity toolkits needs to be updated. For example, the impact of COVID-19 on transportation industry and specifically public transit. You see that how it kind of change and impacts heavily transit-dependent everyday life. So here is an example of a citywide effort to uplift health equity and racial equity through transportation project. So City of Raleigh got a FTA grant for an equitable TOD on city's first BRT corridor on New Bern Avenue. And this avenue actually goes to minority areas, medical centers, and numerous NGOs. They got this grant in 2020, and they started with exploring the root causes of existing issues with asking five why questions, such as why do minorities in Raleigh lack access to higher frequency transit? And they identified actually 5 why questions, and they analyzed root causes of existing inequity in transit using those why questions. For example, for the first why question that they had, why do minorities in Raleigh lack access to higher frequency transit? They found the following root causes: limiting available funding, car-centric policies in place, and third, lack of inclusive community engagement that resulted in disconnectedness between policymakers and transit-dependent communities. And then at the end, lack of diversity at different level of decision-making. So in coordination with the agency Title V, Go Raleigh has evaluated its overall planning program and delivery to identify the key areas where equity needs to be considered or reimagined to be integrated into the whole process. And the process is looking at what Go Raleigh has done in the past and what are the plans for the future. And to understand where equity was addressed and where there are gaps that need to be truly considered. Like, for example, what they did is that it's one of the actually steps that they have taken. Federal Title VI program does not provide you with the detail for early planning process. So if you want to have early planning process, it doesn't provide you with a detailed program. So Go Raleigh worked on recommendation in this regard, in addition to update of Title VI compliance to help future initiative that Go Raleigh or the city is going to pursue. And as a guideline for transportation project, Go Raleigh right now is recommending systemic improvement in different layers of decision making related to transit. As you can see in the slide, and these are 8 steps of this systemic improvement. Integrate, for example, integrate equity into an early planning, or enhancing multimodal connection, or connecting affordable housing and transit plan, and then assess transit related impacts and co-benefits, and incorporate root causes and recurring impacts analysis. So those are some of the areas that they are working on to create actually a systemic improvement for the whole organization. So now our colleague Susan Wood from RTD talks about Reimagine RTD and share key phases of Reimagine community outreach process. Susan's section is recorded, and so if you have any question, please contact me or Susan using our email address.
Hi, I'm Susan Wood. I'm with the Regional Transportation District in Denver, Colorado, and we're the transit provider for the Denver metro area. I'm here today to talk about Reimagine RTD, which is really a plan for looking at the future mobility in the Denver metro area. So before I get started, just a little bit about RTD. We're in we serve 8 counties. We were created in 1969. We serve about 3 million in population, and we provide both bus service and rail service, and that includes light rail and commuter rail, as well as bus rapid transit to the Denver area. So Reimagine RTD is a really important project to us as an agency because it has to do with what we can provide from a future service perspective in the Denver metro area and provide the greatest mobility. It started with a bigger program back in September of 2018 called T2, our Transportation Transformation. And that was initiated by our former general manager to look at mobility in the Denver area and to look at what we need to do going forward in the future to integrate with other systems and make sure that we provide the best efficient service that we can. One of the reasons for this is that the population in the Denver area has been growing and will continue to grow, and by 2050 is expected to grow by approximately 31%. So that's a lot of people coming to the Rocky Mountain region. Also, we know that there are a lot of different transportation changes that have been underway and have come about in the last few years. These need to be taken into account as well. So the purpose of this really at the end of the day is to create a mobility plan for the future. And by future, I mean 2050. That's our planning horizon. We're on a 2-year schedule. We started in the fall of 2019, and with the exception of a pause we've taken due to COVID-19, have been pretty much moving forward since then. There's really 4 key elements to Reimagine. Extensive outreach being the most important of those 4 elements. If we don't get input from the public and those who use our system, what their needs are and what they want to see and what they prioritize, we can't design a system that's going to work well for them. Our ridership will suffer and it won't be efficient, and we won't have the best system we can have. So extensive outreach is critical. Again, 2-year process, midterm and short-term plan in process, as well as the mobility plan for the future, long-term plan coming up as soon as the system optimization plan is complete. So this slide shows a couple of things. It shows our timeline that we launched in the fall. And then it notes that COVID arrived in March of 2020. It certainly has had an effect on the work that we have done and what we've been able to do most recently. We have still been able to make progress. We've done a lot of outreach through virtual outreach opportunities, even during COVID. But in August of 2020, our RTD Board of Directors asked us to pause Reimagine because of the fact we don't know what the outcome of COVID-19 will be, and it would give us a little more time to gather information and see how things are going before we move forward. So we have been paused since August of 2020, but we're scheduled to move forward later this month, or at least in the first quarter of this year, and we still plan to complete Reimagine in 2021. The graphic that you see really is a graphic representation of our community outreach plan, and it is very all-encompassing, actually. There are 3 key stakeholders that are shown at the top. Those rectangles that you see on either side are interest groups that we have done outreach to and gathered input from, and we'll be reaching out to them again. All of the information we've received from the key stakeholders and the interest groups all funnel through the RTD staff into policy recommendations that go to the RTD board for decision. And that's critical too. Our RTD board is somewhat unique among transit agency boards in that they're elected. There are others that are elected, but it's not typically the norm. We have 15 directors and they represent 15 different geographic areas. So they're elected by constituents in their areas, and they receive input from their constituents. This also gives them an opportunity to receive input from those across the district a very diverse group from all areas. So this is really just a summary of the outreach plan and what we've done kind of to date. The key stakeholder groups include the RTD Board, a technical working group, which is really transit professionals from the public and private sector in the Denver area. And then an advisory committee that's really the decision makers in the community, the elected and appointed officials in different local governments or at the state level. There have been 10 RTD board meetings where there have been project updates and input has been received. And there's been 7 meetings each of the technical working group and the advisory committee, and input received from all 7 of those meetings. The community outreach plan is set up in a phased approach. Phase 1 is largely complete. Phase 1 is really an education, is really intended to educate the public and citizens and interest groups about the Reimagine RTD process so they can understand what's being planned and why it's a benefit and why it's important to provide input to the process itself. Phase 2 has been initiated. It's been paused since COVID-19. The COVID-19 pause began in August, but it has been initiated. And this is where we've gathered input on service priorities from different stakeholders and interest groups. Again, if we don't have that input, we can't plan a system that people will want to use. And then phase 3 will be the next upcoming phase, and that's where we have a draft system optimization plan. And we take that back out to the public, and we'll get input that can be incorporated into the final plan itself. We've also used a number of outreach tools. We have a project website where you can comment online. We've had telephone town halls, targeted listening sessions. We have a speakers bureau that's gone out and provided information to interest groups across the region. We've also held employee forums and had formal focus groups and media outreach. And again, the intent behind all of this is to have a very diverse outreach effort so that we get all voices weighing in on what they want to see the future look like for RTD and their transit service in the region. I have to show this slide because it's the COVID-19 slide that shows what our change in transit boardings due to COVID-19. This slide looks very much, it shows ridership, and it shows the drop in ridership actually beginning in March and then continuing on beyond that as a result of COVID. And this looks like probably every other transit agency's graph across the country of ridership during this time. Our lowest ridership went to 68% of the norm, and that was in April. And it's gone up a little from that, but not by much. What's interesting though is that our bus ridership has remained pretty high and pretty steady. And what this indicates is our essential workers who have a need to get to work and are not choice riders, but depend on transit to get to their jobs and schools have continued to use our service. These are our customers. This informs our outreach as well. It helps us to know who we need to be getting input from, and it also helps us to know who we're serving. So I think it's valuable to see this input. So the other input we've received today through our community outreach efforts, we did a statistically valid community survey in July. What we learned from that is that the most important thing to riders is reliable, convenient, and frequent service. And then we also have had, as I said, a number of other outreach opportunities and have gotten a lot of input, but we also did an online survey that, while not statistically valid, certainly provided some good information to us. What we learned is that reliability ranked the highest among all groups by far, no matter what. Reliable service is critical. But what we also learned is that through our targeted outreach attempts is that reliability is important, but equitable access is important as well. And it's good to know this, and it's good to have this voice. We also learned that geographic access is important too. So going forward, where we are today is while Reimagine is still paused at the moment, it hopefully will get going again and be relaunched later this month or certainly in this first quarter of 2021. From here, we'll complete the system optimization plan, and then after that move forward to complete the 2050 plan or the long range plan. In all of these efforts, outreach and meaningful authentic input is key. Again, if we don't have this information, if we don't have this input, we can't design service that's going to meet the needs of the region. And that is what's all important. We need to design service to fit demand. As I said earlier, our RTD board is an elected board, but they're also our decision makers. This gives them an opportunity to look at geographic equity, but also to consider social equity as well. And the input that we receive from our diverse groups of stakeholders will certainly inform the process in that way. Thank you very much.
Thank you, Suzanne. So it was a very interesting project, and they're still working on that. So I'm really looking forward to see what's the result of their community outreach and how they use it in reimagining RTD. So right now we want to have an exercise together. We have a scenario for you. So imagine, this is the story. Imagine that you arrive in a city as the mobility manager. And there are 4 main issues that the mobility department faces due to many interconnected problems that the city has had in the past. The first issue is the broken trust, in the extent that the community doesn't even respond to community leaders' invite to participate in surveys or any other types of event related to community engagement phase for the revision of the 10-year transportation plan that you are working on. And second, broken fiscal system, as a result of mismanagement in a broader scale and lack of sufficient funding to address vulnerable mobility users' needs, such as people with disability, and ill-defined and dysfunctional paratransit system. And third, lack of funding for community engagement effort. And the last one, lack of interest among government agencies to spend money or time to address trust issues through ongoing and consistent community involvement in transportation projects. So to summarize them, the long decline of trust in government, lack of sufficient community engagement funding, history of fiscal mismanagement, and insufficient interest among government agencies to address trust issue. So here is a scenario to start your first 2 years of work as the mobility manager of this city. You're going to start an immediate equitable mobility initiative. And these are our proposed phases for this project. You are going to form initiative team. You're going to allocate the budget. You're going to prioritize action items, and then you set forth a multimodal vision for your agency to meet the challenges. And you will champion for long-term investment in public transportation options to ensure just and sustainable mobility. So the question is that, please let us know when during this 5 phases you start engaging with impacted communities, which method you would use for each of these phases, and why you choose the method that you're choosing to invite the community to the table and collaborate with them. So Jasper will share the link to the Qualtrics in the chat box. You have it right now. So you just please click on the link and start providing us with a few sentences on about the methods that you're going to use and why you're going to choose those methods and when you're going to start the process of engaging the community. And please provide us with any question you have in the chat box, and we're here to answer your question while you are writing your answers in the Qualtrics survey. So again, you're going to be a mobility manager for a new city with a set of issues, and you're going to start for your first 2 years of work, you're going to start an equitable mobility initiative. And we propose 5 main phases for that equitable mobility initiative. And we want to know when you start collaborating with the community, how you do that, and which methods you are going to use, and why you're using the method you are choosing to use for community engagement and inviting community to the table of decision making during the equitable mobility initiative. So you will have a few minutes for that. And I think as we are short in time, I would like to have the section for Miguel Vasquez being played while you're answering the question, and then we can gather your answers actually after the webinar. I just see that we are short in time, so please let me go to the Miguel slide.
Good afternoon. This is Miguel Vasquez. I am the Healthy Communities Urban and Regional Planner for the Riverside University Health System Public Health here in Southern California. And today it is my privilege to be able to talk to you about a project that is going to be impacting our professions. I am a planner, and I am hoping that what you have to hear today will help you focus on the idea of equity in your practice. Today we will talk about the FEEL principles. FEEL stands for Planning for Equity, Advocacy, and Leadership, and we're going to focusing on mainly on one particular principle, acknowledging that the community is in charge. This project came about last year, actually as a result of the pandemic. As you can see here, for me on January 29 was really the first day when I began to see that there was going to be a pattern of unknowns. And I recall some of my colleagues saying, as the pandemic began to unfold, that they were envisioning a new normal. And for me, it was very important that that new normal, in terms of our practice as planners and people who work on issues related to creating and maintaining the built environment, equity was actually going to become a more front and center of our work. By, let's see, last year around this time, you could see that we have very few cases of COVID. And if you see the map today in terms of actual deaths, in this case, in the map, we don't see any deaths of Americans, but if you look at the map today, we exceed the 500,000 mark. Another reason for which this project started, because one of a good friend of mine who was a senior advisor at the US CDC, which is the Centers for Disease Control and Prevention, Chris Kutinsky, he passed away. And at the time he was assisting some of us here in the state of California to organize a set of webinars that discussed how planners were responding to the pandemic. Now, two pieces that came out of the project of developing the FEEL principles, I want to highlight a couple definitions. Number one, to remind you that health equity, according to the Robert Wood Johnson Foundation, is that it means that everyone has a fair and just opportunity to be as healthy as possible, and removing obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness and lack of access to good jobs with fair pay, quality education and housing, safe environments, and healthcare. And the second piece was the main focus of these principles, and we landed on a definition that for the purpose of the FEEL principles, community includes all active and inactive actors in its development. That means all of you and everyone else. For the purpose of this document, community refers in particular to historically overburdened communities with health inequities. Having said that, the FEEL principles encompass three areas: community health and regeneration, community-based advocacy, healing through leadership. And the way that they're organized are by different sections per principle. And today we're going to focus on the one in the middle. But I want to quickly go through some of us, and I highlighted some of those principles that call or speak to the idea of community engagement. And in this case, for Uplift Health Equity, we want to make sure that as we do our work, we are able to heal as a community, and we need to begin by acknowledging historical and current harmful practices. We need to repair broken relationships and build a culture of health and dignity. It is absolutely important that we expand our circles of collaboration. We need to work across disciplines to be able to achieve health equity. We need to also think in terms of prevention. We need to prevent the intentional or unintentional placement of more layers of chronic stress on overburdened communities. In terms of developing healthy and just places, our mission should be to create healthy communities. And for all of that, we need to consider the physical, mental, spiritual, and social health and well-being of our communities as we begin any project. We need to instill climate resilience, and to do that, we need to invest in, and we need to co-empower communities that are most impacted by climate change. We need to reflect on sense of belonging for all. We need to design our places in a way that they become welcoming atmospheres so that we don't cause additional social stress and continued community trauma. We need to anticipate and monitor consequences, or those that are sometimes unintended negative consequences should also be part of our thinking. And we need to establish safe and prosperous communities. For this, we need to also look at ways to reimagine community safety. We need to promote community-based safety measures and models that promote care, recovery, and personal resilience. And here is the focus of our presentation today. And I'm going to just highlight it. This is not intended to be an in-depth presentation. So we need to engage in truthful interactions. What does that mean? It means that we need to center our work on communities overburdened with health disparities. We need to make them our top priorities in our planning practices. We need to do our best effort to see from others' perspective while purposely making choices that frame an anti-racist, humane approach. We need to also strive for veracity, and that means to look at the root causes of toxic stress and community trauma. It is absolutely important that we build trust, and to do that, we need to keep listening and learning from our communities through the planning process. There is this saying of moving at the speed of trust, and we need to be accountable. We need to be able to be transparent, and we need to take responsibility for our actions and our decisions. We need to acknowledge that the community is in charge, and to do that, we need to engage authentically. We need to ensure that our members of our communities are actively included through the planning process. We need to defer to community expertise because the people who are going to be impacted by in this case, let's say a transportation project, they need to be able to be part of the process. And we need to make sure to honor their knowledge, their history, and also their institutional memory. We need to empower, and to do that, we need to balance the scales of power so that communities can be part of the influence that will lead institutional, policy, and system changes. And we need to plan with collective impact. all of the players at the table can help create a plan that is more equitable for everyone. We need to figure it out together. And to do that, we need to be able to imagine, we need to build diverse partnerships in creative processes that envision the incorporation of stories in culture during the plan making process. We need to be able to feel, and to do that, we can consider using artistic or tactical interventions as new ways to engage our community members. And we need to also validate the power of data. In numbers alone are important, but it's absolutely essential that our plans also include the stories of the community's experiences and histories in the decision-making process. And lastly, our last principle has to do with advancing racial equity, and I highlighted a couple passages. One, we need to be able to reconcile, and we need to acknowledge and communicate the impact of racial inequities so that institutions and organizations can march toward healing and reconciliation. And with that, this is the end of my presentation today. My contact information is provided, and you can also access the full document and all the principles with the expanded language at State of Place. State of Place is a private firm that has been hosting our project until we're able to find a permanent location for the principles. So take a look at it, and I thank you for your time, and have a great day.
So thank you very much, Miro, and I do apologize. We run 10 minutes out of our time. It was a very good introduction of the field principle number 2, community-based advocacy, and how we can use it in community engagement. We will expand on it during upcoming courses. So it was a very, very brief journey on what is and is not equitable about community engagement. We actually opened the discussion, and in upcoming course, we will expand on it. We will offer 2-day certification course with 2 speakers who will present their work live. And each course has 2 group activities being completed in breakout rooms. We will have also several group discussion of 3 different engagement methods. The course will also review existing federal guidance aligned with several statewide tools and provide examples of how to apply those tools to different types and scales of transportation projects. So time was limited for these 2 intro webinars. We will have quite a journey in upcoming 10-hour 2-day course, a good amount of time to extensively focus on when, how, and why of the community engagement. We received a few responses to the Qualtrics question. I just want to read 2 of those. One of the participants mentioned that we should start collaborating with the community when we begin forming the initiation team. Community stakeholders should be involved from the beginning. Start with invitation for collaboration, then move to surveys and workshops with the community members. And then another participant mentioned that when the new team has done their own homework and research, the new team will actually include the community member as partners. And listening sessions are very important to begin to build trust throughout the process. So thank you very much. We are waiting for your responses. Your responses actually help us to design a better exercise for our upcoming course in summer. So we are eagerly looking forward to seeing you for our upcoming course on equity in transportation. Please feel free to send me any question that you have or any issue that you need to be addressed and be discussed in the course. Thank you everyone for being here with us today. It was a pleasure for all of us to talk to you today. Stay healthy and happy, and hopefully we can meet someday in person after getting vaccinated. Thank you very much. Stay healthy. Bye.